First of all, thank you all for coming this afternoon. We wanted to take this opportunity to allow you to answer questions, for us to answer questions for you regarding the COVID-19 infection and outbreak. Earlier today, we released a written statement regarding this infection. Again, we want to try to alleviate some of the fears in our community about this and to make sure that we're putting out accurate information for the community. So I'm happy to take your questions at this time.
And where does Pitt County stand right now?
Right now, we have no reported cases in Pitt County. There has been one case reported in North Carolina. That was in the Wake County area. That case was linked to travel from Washington State, where there was an outbreak in a nursing home. And that individual visited that nursing home, apparently, and contracted the infection there. Our role is to help support the medical providers in the community with information. We serve as a liaison between local providers and the state health department and or potentially the CDC if need be. So we provide consultation and support to local healthcare providers. Last night we did add a page to the Pitt County Health Department website that addresses information about COVID-19. We can provide you all with a link for that so that you can get to that. Things that people can do. This virus spreads like cold viruses or like the flu virus, respiratory droplets. So when people cough or sneeze, those droplets can sometimes land in our eyes, nose, or mouth and give us the infection that way. Those droplets can persist on surfaces for a period of time. We're not sure how long. Some studies suggest 6 to 8 hours. Some studies have suggested potentially longer. So it's important to wash your hands frequently and to not touch your eyes, nose, or mouth if your hands have not been washed after touching common surfaces. Hand sanitizer is effective against most of these types of infections, and as far as we know, it is effective against COVID-19 as well. The alcohol in the sanitizer helps break up the encapsulation around the virus so that it is no longer infectious. Well, personally, I have not seen a case of COVID-19. But what is being reported is that individuals 60 years and older suffer more severe disease. People who have underlying medical problems such as heart disease, diabetes, asthma or other chronic lung disease, and other diseases or conditions that might weaken their immune systems have a worse case of this virus if they are unlucky enough to get it.
So we see it.
Yes, as we age, our immune system gradually loses some of its ability to fight infections.
What about when
Most younger folks seem to have a very mild illness with this and seem to ride it out like they would any other cold virus. We do not do testing here at Pitt County Health Department. The testing right now is being done at the State Lab for Public Health in Raleigh and at the CDC. So if there were a suspected case here in Pitt County, samples would be sent from Pitt County to the state lab. They would run a test at the state lab. If the test at the state lab was positive, that sample would be forwarded to the CDC for confirmatory testing. We have had individuals present to local medical providers seeking testing, but they have not met the guidance that's been established by the CDC for testing.
What is that guidance?
The guidance requires them to have traveled to China or to have been exposed to a known case of COVID-19 and then to have fever, cough, plus or minus shortness of breath. The symptoms that seem to be most common in this are fever, cough, and then shortness of breath if people develop the pneumonia that has been associated with it. Influenza has a very abrupt onset in most individuals and begins with a sore throat, cough, high fever, usually fever 101 or 102 degrees Fahrenheit, and intense body aches. And we do not seem to see the intense body aches with this infection that we see with influenza. I have frequent contact with my partner in the Office of Prospective Health at ECU, and we work with them to answer questions and develop a strategy for some cases that are outside of federal guidelines. Well, we certainly would hope so. An infectious disease colleague of mine thinks that when the warm weather gets here and stays here, that will help decrease the spread of this virus. So we can keep our fingers crossed for that, but we have no evidence to prove that yet in the wild, so to speak. For the vast majority of people, this would likely be a mild illness, a mild to moderate illness. Again, for those folks that are over the age of 60, or who have underlying medical problems, the infection may produce more severe illness in those folks. As far as what to have at home, soap and water works just as well to wash your hands. The hand sanitizer is convenient to keep in your pocket or your purse or briefcase, whatever, but it's not a must. Masks probably don't offer a lot of protection on the day-to-day level. I personally don't have any masks in my house. I do, if I were to see a patient who had even the flu, I would put a mask on to see that patient to protect myself from the infection, but I don't know that carrying around masks is going to help anybody directly. As far as stocking up on things, right now there's no evidence that we're not going to have food or water or milk or bread or anything like that, so I don't know that people need to be stockpiling groceries or anything like that. I've said to my staff in a message earlier today, the most important thing to do is to not panic. When you panic, you lose control, and when you're not in control, you can't help yourself or your family or anybody else. Federal government says that there may be a vaccine candidate ready for trials in the next month or two. We'll see if that happens. There is an investigational drug that has been tried as an antiviral agent to treat the infection. That has shown some promise in the early trials, but it is not Food and Drug Administration or FDA approved yet.
Thank you so much.
All right. Thank you, folks. Really do appreciate you coming and helping us get the message out today. There's a lot of fear, and I don't think people need to be afraid at this point.